Thank you, Dr. Shackett and Dr. Oberg. I'd like to share with you some important information on a very common tumor, the choroidal nevus. We're going to discuss three issues: the clinical spectrum, does nevus differ in young versus older adults? The outcome of visual acuity with choroidal nevus, and lastly, the outcome of growth into melanoma. So let's begin with the clinical spectrum. We looked at over 3,000 patients on the oncology service at Wills Eye Institute and found that only 2% of all patients we see with choroidal nevi are young, 23% are middle-aged, and 75% are older age. Are the clinical features of choroidal nevus different in young versus older patients? Well, let's look. We found that there was no statistical difference depending upon the race, the sex, or the presence of melanocytosis in these three age groups. But notice that most patients we see with choroidal nevi are female in all three groups. Then we next looked at symptoms and color of the lesion, and again, there was no significant difference between the three groups. Moving into the distinct features of the nevus and location, we found that there was no difference in the location antero-posteriorly. Most nevi tend to occur around the equator in young, mid, and older adults. And we didn't find any difference in the quadrant location of nevi between young, mid, and older adults. About 20% of them occur in each of the quadrants in the eye. But there were three clinical features that did differ among the three different age groups: the number of nevi per eye, the nevus thickness, and drusen. If we look at the number of nevi per eye, more than one nevus was seen in 2% of young people, 8% of mid-adults, and 10% of older adults, and this was statistically different. Also regarding thickness, in young adults it was 1.2 millimeters in thickness, and in older adults 1.6 millimeters. It doesn't look like much of a difference, but it was statistically significant. Now keep in mind, I'm speaking to you about a clinic-based population, which is really different than the population-based situation from the Blue Mountain Eye study, where their mean tumor was 1.2 millimeter in diameter and our mean tumor was 5.1 millimeter in diameter, much larger than a population-based study. And then regarding drusen were seen in 11% of young patients, 40% of mid-adults, and 58% of older adults. This was statistically different. So here you see a template of 6 young patients with choroidal nevi, very little RPE alterations, drusen occasionally seen over nevi in young kids. But as you age, you start to see more RPE alterations, drusen, fibrous metaplasia of the retinal pigment epithelium, and in older adults it's very common to see drusen, pigment epithelial detachment, and RPE alteration. Now on to our next issue, outcome of visual acuity. Well, at date first seen, all patients, the average visual acuity was 20/20, and at date last seen, 20/25. But if we divided the nevi into extrafoveolar and subfoveolar, keep in mind the foveola is that point in the middle of the fundus, not the fovea, the foveola. There were 205 located under the foveola. And we look at initial and final vision, again it's about the same average vision, about 20/20 initial and about 20/25 to 20/30 initial. But if we compare vision loss at 15 years, we see a strong difference. Extrafoveolar lesions tend to show very little vision loss at 15 years, only 2%, whereas subfoveolar choroidal nevi produce vision loss in 26% by 15 years. Of all the patients with choroidal nevus, the main risk factors predictive of poor final vision included orange pigment, subfoveolar location, RPE detachment, and foveal edema. These two patients have good vision. We expect the one on the right to continue with good vision, but the one on the left has an 11 times greater risk for poor vision in 10 years based on the subfoveolar location. RPE detachment promotes a 13 times greater risk for poor ultimate vision. Orange pigment, 4 times greater risk for poor vision. Retinal edema, 19 times greater risk for poor vision. And here we see a more profound case with overlying retinal edema overlying a choroidal nevus. Now lastly, the most important issue, outcome of growth into melanoma. Do we really think this lesion is going to grow into melanoma? The answer is no. How do we know? Well, the features. It has drusen and RPE alterations, likely to remain stable. How about this lesion? Maybe there's orange pigment overlying it and a little bit of fluid. So there are risk factors that have been identified to predict which nevus is going to evolve into melanoma. Thickness over 2 millimeters, fluid, symptoms, orange pigment, margin near the disc. This lesion has 3 factors. There's a 50% chance that will grow into melanoma if you watch it long enough. This lesion has all 5 risk factors: thickness, fluid, symptoms, orange pigment, and margin within 3 millimeters of the optic disc. 60% chance it will grow within 5 years. Now, in our somewhat biased series of worst case scenarios sent to an oncology service, we found that nevi grow into melanoma in 17% by 15 years. Again, this is not a population-based study. This lesion we doubt will grow into melanoma, but this lesion with risk factors carries a substantial risk for growth into melanoma. Lastly, we have reanalyzed our data, and we looked at the 3,400 patients and have added 2 more risk factors to our list of risk factors. I've indicated to you thickness, fluid, symptoms, orange pigment, and margin near the disc. The 2 new risk factors include ultrasound hollow and halo absent. So we have amended our mnemonic. To find small ocular melanoma using helpful hints. U for ultrasound, H for hollow, and H for halo absent. So now you can remember some important facts about a common lesion, the choroidal nevus. From a clinical spectrum standpoint, number of lesions per eye, thickness, and drusen increase with increasing age. Visual acuity, well, orange pigment, subfoveal location, pigment epithelial detachment, and cystoid edema promote poor vision. And then growth into melanoma, well, just remember the mnemonic: to find small ocular melanoma using helpful hints. Thank you.